We turn now to health this morning. So May is Mental Health Awareness Month, and many organizations are raising awareness for those affected by mental illness. Didi Hirsch Mental Services is a renowned leader in mental health care and suicide prevention, and they will host their inaugural Mental Health is Health experience streaming Wednesday, May 26th at 6:30 p.m. And joining us now live via Zoom is Dr. Jonathan Goldfinger, CEO of Didi Hirsch Mental Health Services, and Melissa Rivers, TV personality and mental health advocate. Good morning to you both. Thank you so much for being with us.
Good morning.
Morning.
So, Dr. Goldfinger, let's start with you this morning. The movement began over 25 years ago. So tell us how this all got started.
So now 25 years ago, this would be our anniversary. Advocates in the mental health space recognized that people were not getting care because they weren't acknowledging that something was wrong. And this is what we call stigma, that mental health or mental illness, substance use, a history of thoughts of suicide, or even an attempt or a loss in a family, actually people feel discriminated against if they come out and talk about it. And people did not. And so what we did was erase the stigma by creating awards for people who actually had the strength, came out and talked about it to encourage others to do the same.
And Melissa, it just wouldn't be a year here at Spectrum News 1 without you joining us every time around this year to advocate for Didi Hirsch. So thank you again and great to see you. Share with our viewers why this is such a personal passion for you, how you know firsthand what families so desperately need in times of crisis.
In times of crisis, people need support. You know, I lost my father to suicide in '87. And that's when my mother and I both went through something that was just obviously horrific. And there was no advocacy. There was no, everyone wouldn't talk about it. It was very hush hush. You know, suicide was very much, you know, an embarrassment in a family. And so immediately we started speaking about it because we realized we were not alone. And I always say that losing my father to suicide, which is one of the most horrific things in my life, has turned into something that's really been empowering and important and given my life so much purpose in the sense of I get to be a mental health and suicide prevention advocate. Somehow along the way, Didi Hirsch let me onto their board. So, you know, as I always joke to John, clearly, you know, we're not keeping the mental health thing going in-house because how did I end up here? But, you know, one of the things about Didi Hirsch was in the beginning when I became part of it, it was all about erasing the stigma. And that is the thing I've been screaming from the mountaintops for 30 years. And it's so exciting that we've taken it to the next step. We're now calling it Mental Health is Health and really making it part of our health conversation. As you would go to an orthopedist if you broke your wrist, if your emotions are having trouble and your brain is having trouble, there's a doctor out there for you. And it should be included in our healthcare system. It needs to be looked at. You know, people hate the words integrated health. It sounds so woo-woo. But honestly, we need to take mental health really seriously. It is part of our body and part of our daily experience. And COVID's really brought that to the forefront. Easy for me to say.
But we get it.
That's so true. And what are some of the other resources that Didi Hirsch offers?
So we are available 24/7 on the National Suicide Prevention Lifeline at 1-800-273-8255 in English and Spanish. But we also are on a host of other lines. National Disaster Distress Helpline. We support the Teen Line and LAUSD line, and also Crisis Chat. People can go to crisischat.org if they don't want to have an out loud conversation about how they're feeling. This number will soon become 988 if people are following the federal law, and that will come to Didi Hirsch. But we also provide a host of whole person mental health services, from therapy to substance use treatment for children, adults, and families. And for our organization, it's really important that people, as Melissa said, begin to think of the mind and body the way they are, which is inseparable. And that's how their care should be.
And without the stigma that's normally attached to it, no shame, just outreach of help. And just really quickly, Melissa, what can we expect from the event? Wow us so everybody who's watching can tune in and support.
Yeah.
On May 26th, starting at 6:30 in the evening, we're going to be streaming our virtual gala. We have amazing guests. We've got Sherry Shepherd hosting. We're introducing our two newest ambassadors, Bibi Rexa and Selena Gomez.
Woohoo! Love her too.
Very exciting that we've gotten to team with them and with Selena's brand Rare Beauty, and to be able to start to reach the next generation of advocates for mental health is going to help us move the ball further down the field. You know, we're so proud of Didi Hirsch and our organization in really being the leaders in pushing legislation on both the state level and the federal level. So to be able to be on the forefront of these new text lines and moving 988, which would be a crisis hotline, you only have to remember 3 numbers, and getting that closer and closer to the goalpost, bringing in this next generation is going to help continue the push forward, which is, you know, we're still erasing the stigma, but now we need to take the next step.
Well, you've done a lot to erase that stigma, Melissa, and we love having you on.
And get online and donate, and it's a great cause. And I think the last year has taught us all how important mental health is.
Oh, more than ever. Well, it's so great to see you, Melissa. You're welcome back anytime. Dr. Goldfinger, thank you so much as well.
Thank you, Melissa. Thank you, Dr. Goldfinger.
Yeah. Goldfinger.
Yeah. Thank you all so much. And for more information, you can visit didihirsch.org. We'll be back.